everyone. Today we are going to discuss the upper limbs, and the upper limbs we divide into four section. Okay, first section, if you will talk about the upper limbs we divide into four section. Okay, our topic about muscle upper limb. First we have shoulder muscle, shoulder griddle muscle, second we have arm muscle, third we have forearm muscle, and fourth one we have hand muscle. Okay, now today first we will discuss in upper limb shoulder griddle muscle. Okay, shoulder griddle muscle we have six muscle. First we have deltoid muscle, musculus deltoidus. Second we have subscapular muscle, subscapularis muscle. Third we have supraspinatus fossa. If you remember the supraspinatus fossa in scapula bone. Okay, fourth one we have infraspinatus fossa, infraspinatus muscle, and fifth one we have teres major and teres minor muscle. Now we are going to discuss each muscle of the shoulder girdle, origination, insertion, and function. Okay, and I will show this is the posterior view of scapula. Okay, and this is the humerus. Now first we will going to discuss the first muscle of this topic. The first muscle we have deltoid muscle, musculus deltoidus muscle. Okay, you know this is a scapula, this is a supraspinatus fossa, this is a infraspinatus fossa, this is a spine of scapula, this is the humerus bone. Okay, and deltoid muscle, if you remember, this is deltoid where the injection site. Okay, deltoid muscle origination from here. This is a acromion process, and here we have clavicle. Okay, don't forget it, clavicle. Okay, this is acromion, and this is a spine process. It means this muscle origination from three parts. This muscle origination, and this muscle come to insert it, means attachment of these muscles. Okay, here you have this muscle attachment. These are the deltoid, musculus deltoidus muscles. Three origination from the three parts. Okay, if you will write origin and insertion of deltoid muscle, then we will need to write here clavicle, second acromion process of scapula, third we have here the spine of scapula. It means origin of deltoid muscle from the three parts of scapula. Okay, three different days from clavicle bone, acromion process of scapula, and spine of scapula. Okay, and inserted into the into the tuberosity, and this tuberosity means deltoid tuberosity, and deltoid tuberosity where deltoid tuberosity is present in the humerus bone. Deltoid tuberosity of humerus bone. Okay, and if you will talk about the function of this muscle help in abduction, adduction, flexation, extension, and rotation. You know why I told like this function for adduction, flexation and extension and rotation? Because when they have the different parts, when the different parts, like if the clavicular part extend, they help in different function. If their spine part is contract, they have different function. If this acromion part is contracted, they have different function. That's why I told they have help, these muscle help in adduction, flexation, extension and rotation. Okay, then the second muscle we have, this is the deltoid muscle. Okay, then second muscle we have subscapular muscle. This is the anterior, I told this is posterior view, but subscapularis muscle we have in posterior view of, if you know, this is the scapula, this is the scapula. Okay, this is the posterior view of scapula, and here is our humerus bone. Okay, now if you remember, this is the subscapular fossa. Okay, and here this muscle originated from the subscapular fossa and inserted into the lesser tuberosity. Here we have lesser tuberosity of the humerus bone, lesser tuberosity and crest of what bone? Humerus bone. Okay, here I will the second muscle we have subscapularis muscle, subscapularis muscle. Okay, if you talk about the origin and insertion. Okay, origin, subscapularis muscle. Okay, subscapular origin from the subscapular fossa, and inserted in where? Lesser tubercle and crest of humerus bone. Okay, and if you talk about the function, then here adduction. Okay, we have this muscle help in adduction. Okay, now we have third muscle. Okay, third muscle we have supraspinatus muscle, and he will talk here in the posterior view. Okay, because this muscle we have in posterior view. Third muscle, supra means upper, supraspinatus fossa. Okay, origin and insertion. I will show where the supraspinatus fossa, muscle. Okay, where the supraspinatus muscle here. Do you remember this is a fossa? I told this is here. This is a supraspinatus muscle. This is a, and they are coming here to insert with the greater tubercle of the what? Humerus bone. Okay, these are the which muscle? Which means origin of the supraspinatus muscle from the supraspinatus fossa, and inserted where? Greater tubercle of a humerus. And okay, if we will talk about the function, this help in the rotation and flexation, and also in abduction. Okay, now fourth muscle, infraspinatus muscle. Infra means lower, and infraspinatus muscle, if we will talk about the infraspinatus, it means from the origination from lower, infraspinatus fossa. Infraspinatus muscle means from lower muscle. We will write first here, we will talk origin and insertion. Okay, simple. O from I, O from origin and I from insertion. So now this is the whole is a what? This is the infraspinatus fossa. infraspinatus fossa. These are the infraspinatus muscle. Okay, and these infraspinatus muscle are also inserted into the same region. Okay, greater tubercle. Okay, it's mean to we will write origin of the infraspinatus muscle from the infraspinatus fossa. Infraspinatus fossa. Infraspinatus fossa and insert into the same greater tubercle of humerus. These also help in abduction, okay, and rotation, but external. Okay, now we have other muscles, and the fifth one muscle we have teres major and teres minor muscle, but first we will discuss teres minor muscle. Okay, if you talk here, this area, okay, here the middle, lateral margin of scapula, and insert it where? Into the greater tubercle of the humerus. Okay, muscle name teres minor muscle. Okay, if you will talk about origin from the lateral margin of scapula plus insertion where? Greater tubercle of humerus bone. Okay, if you talk about the function of this muscle, they are help in flexation and external rotation. Okay, now we'll continue our topic about teres major muscle, because we teres minor muscle we already discussed. 6 muscle we have teres major muscle. Okay, and teres major muscle we have here, from here. Okay, this whole area is origination from the inferior angle of the scapula and insert into the lesser tubercle and crest of the humerus bone. Okay, now if you talk about the origination of the teres major muscle, then we will write here inferior angle of scapula. And inferior angle, you know, if you remember the osteology, inferior angle of scapula, then you will remember the 3 angle of the scapula. Okay, then insertion into the lesser tubercle and crest of humerus bone. Now if you will talk about the function of this muscle, function is abduction and internal rotation. Remember the teres major we discussed external rotation, but here is an internal rotation. Okay, these are the shoulder girdle muscle, 6 muscle: the tight muscle, subscapularis muscle, supraspinatus muscle, infraspinatus muscle, teres major muscle, and teres minor muscle. These are the 6 muscle which help in the shoulder joints for moving, for the abduction, adduction, and flexation and extension and rotation. Okay, external and internal. These are our topics.